Okay. Very good. Hello everyone, Dr. Rich Castellano here with Bettina today. Thank you, Bettina, for coming today and allowing us to do the video to teach about your fillers. Now, Bettina, we are so proud of her. Just take a look. These are her, we call these the nostalgia pictures, how young she is here, and she's done a lift with us and a few sessions of the fillers, and she looks so natural. She looks good from pretty much every angle, and you can see here how the neck and jawline have tightened. We're doing a little touch of facial fillers today. And thank you all for joining in. Thank you for tuning in. So now you can see the other oblique side, and I like to compare them to the younger pictures. You see how much volume we have in our face when we're younger, okay? So what we do is we're just trying to put that volume back, but her profile looks good. These are from her pictures today to her original treatment where we did the lift. And so now that you can see some of her before and after pictures here, okay, and we'll go back to the original. Of course, we always look best when we smile, but no one tells her, say, hey, it looks like you've had something done. Oh, thank you very much, Amy. Yes, she does look amazing. Any comments from family or friends, Bettina?
People are amazed.
Can we share with them how young you are?
I'm 81.
81 years old. This is not the picture of an 81-year-old, so we're very proud to work with you and help. And Bettina has many active years ahead of her. So what we're going to do is we're going to zoom in. I did a tiny bit of numbing medicine for her. I'm going to do a little bit more. So we're going to do some of the injections. And we're using the Bellafill today, and Charlene has everything set up perfectly for us. Thank you, Charlene.
You're welcome.
Okay, very good. And so I do the cleanse on my hands, and I've got my gloves, and we've done a few sessions of the Bellafill. It's always better to be gradual when you add the Bellafill in. Yes, she said, woohoo, Tina. So Bettina is doing such a great job. We're very proud of her. She has many active years ahead of her. Now I'm going to use some of the lidocaine. And so what I do is that we have this little buzzer. It's kind of a distraction. The brain can only focus on so many things at one time. And then we use the little lidocaine. Hello, David. Thanks for joining in. So now we're going to, you may have you rest your head all the way back for me. That's perfect. So you feel buzz and pinch. 1, 2, 3, pinch. We're going to do a little bit in the temple today and just a tiny bit in the brow. 1, 2, 3, pinch. A little pinch there. And then Bettina wanted to do a little bit around the orbital rim, which you have to be very delicate in that area, but we'll do a small touch for her there. Very small amount just to balance. And then some here in the back of the jawline, little pinch. Now I've already done some of the numbing medicine over in this area here, so you might feel a little bit of a pinch there, Bettina?
No.
Okay. Everything's looking good. Fillers are the future, pinch, of plastic surgery. There's no downtime. People do not want surgery today, so she's a little sensitive there. Let's let that area settle in. And so fillers are great. We have long-term fillers. The Bellafill, the polymethyl methacrylate, is non-absorbable. I'm going to turn your head this way a little bit. So pinch on 3, 1, 2, 3, pinch. Sorry, a little tender area. So she'll feel some pinches while I'm doing the numbing, a little pinch. And then after that, it's much more comfortable. Pinch on 3, 1, 2, 3, pinch. That's a tender spot, so we'll just let that settle. And she's been doing her ice while we've been prepping. Pinch. Sorry, that's a little tender there. Hold a little pressure. And then we're going to do a little spot right over here. On 3, 1, 2, 3, pinch, little pinch. Okay. How are you doing, Bettina?
Good.
So now I'm going to go back to those areas just to test and do a tiny bit more numbing. Let me turn your head this way just a little bit. That's perfect. Okay. You feel a little bit of a pinch here, Bettina?
Yeah.
Okay, she feels it there. Let me put a little. So we go very slowly, so that way when you feel little pinches, how about here, pinch or not so much?
No.
Not too bad?
No.
Okay. How about over here, a little pinch? Little bit?
Little bit.
Little pinch here? Not too bad?
No.
And little pinch here? Not too bad?
No. Yes.
Little bit there, okay. Try not to beat up on you too much here, okay. And then here, do you feel a little bit of a pinch?
Yeah.
Okay. So little baby steps. We've already done a cleanse on the skin. I'm going to do a little bit more cleanse. Now, Over here, do you feel a little bit of a pinch or not really? Little bit there or not
A
really?
little bit.
When you go slowly, it makes all the difference. So she'll be a little tiny bit swollen just because of the numbing medicine. Thank you for tuning in. Please do follow us on Facebook at ImageLift, on YouTube at ImageLift, all the social media, and please share, let others know. You feel a little bit of a pinch here?
Nope.
Little pinch here?
Nope.
Very good. Okay, so now I'm going to start. There's a few of these areas where we get these creases. So this is the Bellafill. Okay. Hello, Francis. Good to see you. Nancy, good to see you. So this is what we're injecting with the Bellafill, and that is the 27 gauge 1/2 inch needle. And so this is an intradermal injection. And she may feel a little bit of a pinch or not that much. So what I'm doing is I'm just trying to thicken the skin. And I'll use a cannula for deeper injections. Thank you for tuning in. Thank you for the hearts and shares. If you're watching, please let us know. Are you in the United States or are you international? We have people from all over the world watch our videos from Periscope. Very good. Can you read if there's any comments there? Okay, very good. And how about here? Do you feel a little bit of a pinch? Not too bad?
No.
So, bless you, Charlene.
Thank you.
Little pinch. That one's that's a tender spot. So and there's some numbing medicine in the filler. There we go. So she felt the pinch there.
Watching from North Carolina.
Little pinch, 1, 2, 3, pinch. So I'm just putting very small amounts, 0.05 cc's in an injection. And patients may come back for multiple little sessions, but the little sessions add up. As you can see in Bettina's pictures, we're so proud of her. Hello, Julianne. Thanks for joining in. So we did a little bit through those areas. Now I'm going to make the insertion point. Do you feel a little pinch here or not really?
No.
How about here? A little pinch?
No.
So those are the insertion points where I'm going to place the cannula in just a moment. Let me turn your head this way to the side, and then we're going to do a little touch here just to try and thicken the skin some. And she feels a little bit of a pinch. Perfect. Make a big smile for me. There you go. Now relax as best you can. Now, do you feel a pinch here?
No.
And these are the insertion points where I'm going to put a little bit more of the filler. And so, always better to take smaller steps. Now this is the cannula, 1.5 inch 27 gauge. Okay. Now I like to do a little bit in the brow because we get a little hollow in those areas. So you'll feel a little pressure. Little pinch, pressure, pinch, pressure, pinch. And I use the twist technique when I use the cannula. Just that little twisting, and then a little bit of the numbing medicine here. And I use the shiver technique when I inject, because when you do this shiver, you inject very, very small amounts of the product because you want to do a very fine distribution of the product. Pressure, pinch, pressure, pinch. A little pinching there. Bettina, how are you doing, dear?
I'm fine.
So a little shiver, just putting a little bit there in the brow. Thank you for tuning in.
It's amazing what a smile can do.
Yes, the smile certainly does a lot. Hello, Kirsten. Thanks for joining in. Very good. So I'm just placing a little bit of the product here, just a small amount, about 0.3 cc's total. And then I'm going to do some massage, and that just flattens the area. Make sure that it's nice and even. I like to recommend a 5-minute massage 5 times a day for 5 days.
What is she getting done?
We're doing a Bellafill injection. We did some around the mouth. We're doing a little bit to the brow and the temple. and then we're going to do some to the back of the jawline as well. Very good. Thank you for following and thank you for sharing. We're here in Tampa, Florida, and in the Villages, Florida, and you can look us up also on Amazon. We have 2 Wall Street Journal best-selling books. Now, Bettina, you had a chance to read our book before you did your lift.
Yes.
What did you think about the book? Was that helpful before
Yes.
the lift?
It gave me a lot of information.
Pressure pinch, pressure pinch. I just had a patient come in and she said she read the book a couple times. It was very informative. She is a nurse. So our book is an excellent book if someone is considering a facelifting procedure.
I liked it because I wasn't being put to sleep.
That's the primary reason. People don't want general anesthesia and they don't want traditional facelifts.
Can you please tell us a little bit about Botox?
Botox weakens the muscle, so that way you don't form the creases as much. So she's got a little bit of swelling. I'm going to do some massage and press in those areas and just make sure it's nice and even. And even if I inject nothing, Bettina's going to have a little bit of swelling from what we do. So as I tell patients, you don't want to taste the chocolate cake before it's done baking. Hello, Mike. How are you? Good to see you. Thanks for tuning in. Please make sure you're following and sharing. Follow us at ImageLift on Facebook. We're doing some facial filler here for Bettina. We'll show her pictures again in just a moment. She did the lift with us. She's done a few sessions of the fillers. It's always, hello, Katrina. Good to see you. Thank you. Yes, I agree. You always want to look good, feel good, do good. That's our mantra.
Do you use numbing before?
Yes, we did do a little bit of numbing. We also did cleansing on the skin before we started the video. Perfect. Now, I'm going to do a little bit more in the brow, and then we call this lateral orbital rim. This is advanced technique, so you should not do these techniques unless you're an experienced. This is not for beginners or intermediate injectors. You only use advanced technique here. Very fine amounts, very small amounts. Everything's looking good. Perfect. And I always like to make sure that I massage vigorously. Perfect. And I like to hold pressure on some of the areas after I do the injection. Now I'm going to have you turn your head to the side. Very good. Bettina, are you feeling any pain at all, dear?
No, I'm fine.
Patients usually don't have so much pain afterwards. They may have a little bit of sore or achy, but a lot of times, now Bettina might feel a little pinch here and there, but she's not going to feel too much from what we're doing. Everything's looking good. Thank you for tuning in. Thank you for the hearts and for the shares. Bettina was very gracious to allow us to share and teach, and our patients come in and say, hey, I saw what Bettina had, I want to do what she did. And so it's a very good teaching platform for us to do the videos. Pressure pinch, pressure pinch. Now I'm doing some in the temple. Hello, Jason. Thanks for tuning in. Yeah, when the numbing wears off, still there's really not so much. I don't give pain medicine. I mean, you can take Tylenol or Motrin, but it's not really necessary to do pain medicine after fillers. You feel there's a little pinch there. Now here's the cannulas all the way up in this area, right in through here. So now I'm just going to use my little shiver technique to just fill, and they'll be numbing as we inject because there's numbing medicine inside of this filler. Everything's looking good. Perfect. So after I inject, I love to do the massage. So we've done lateral orbital rim, we've done temple, we've done the brow a little bit, and she's going to be a tiny bit swollen, which is to be expected. Very good. Do a little bit more on the other temple. Bettina, I'm going to have you turn this way. Thank you so much. And then I pinch the skin to find where I made the little insertion point. And I do my twist technique to advance the cannula with the least amount of trauma. Pressure pinch, pressure pinch. There's a little tender spot there. Now, once I've advanced the cannula, the tip of the cannula is right here where my finger is. Someone said, we don't change on the inside. The best way to change on the inside, put a smile on your face. And when we change our external appearance, it does change our behavior. It can contribute to changing our identity. It's like if you dress up really nicely, makes you feel good, and you can be a little bit more outgoing, and pressure pinch, pressure pinch. Little tender spot there, okay. How about now, Bettina? Do you feel a little pinch?
No, it's fine.
Okay, good. So what I'll do is I'll adjust to make sure that she's comfortable wherever I'm injecting. If I see that she's slightly uncomfortable, then I'll readjust, try and make her feel comfortable, and then once I can inject some of the product with the lidocaine, then she won't feel it so much because the lidocaine will start to numb the area. Thank you for the shares. Thank you for the hearts. Everything's looking good. Hello, thank you for tuning in. For those of you just joining, I am Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon. We're here with Bettina today. She's done the lift, she's done some fillers. We're going to show her pictures here in just a moment. We're wrapping things up. We're just doing a few little touch-up syringes. Perfect. Okay, now after I inject, I like to do a little bit of the massage. And once we're done in these areas, I'm going to do a little bit more through here. Let me turn your head this way a little bit. So I like to hold pressure, I like to massage. Now, the crow's feet is often treated with Botox, but that only lasts 3 to 4 months, so most people recognize that you have to repeat that. And if you build up the brow, you can help soften some of the crow's feet area just by lifting that. That's a little bit of a tender area, so I'm going to do a little bit of an injection. The twist technique does help to minimize the trauma as you, there you go, a little pinch, as you advance the cannula. And then I'm going to inject near the back side of the temple as well. Everything's looking good. Pressure pinch. Good. Perfect. Chemical peels can help with crow's feet. Thank you for asking. So 5-minute massage 5 times a day for 5 days is what I recommend afterwards. I'm going to do a little bit in the back of the jawline here. We lose bone in our bony prominences, the back of the jaw, the temple, and the brow. So what I'm doing is I'm just re-inflating in those areas. So now I'm straight across the back of her jawline here, which feels a little pinch there. I'm going to do some massage here in just a moment. Bettina, do you feel a little bit of a pinch there, dear?
Yeah, I did, but not now.
A little bit of injection, so I did just a tiny bit of an injection there. Everything's looking good. So someone said, what do you recommend to get rid of laugh lines and crow's feet? So of course the most attractive thing we do to our face is smile. So I never recommend, you should always smile. Smiling is going to make you look good and feel good. And you don't want to be a perfectionist when it comes to facial plastic surgery. If you make the face totally perfect, it doesn't look natural. So what I typically recommend is get some improvement as much as you can. There's our 4 categories: tightening, volume, skin, and behavior. And so you do the best you can with those areas. Let me turn your head this way a little bit. But you just don't want to go overboard. So now you can see the back of the jaw. I'm just going to define a little bit in through here. They said you're looking good. I agree. Yeah, they said some of the actresses had their molars removed to accentuate their cheekbones. Yeah, I can believe that. Pressure pinch, pressure pinch. So I feel a little bit of the collagen and the scar tissue from her lift in this area. There we go. I'm gonna do. And I use this shiver technique to disseminate very small amounts of the filler. Everything's looking good. How are you doing, Bettina?
Good.
Perfect. So once I inject, I'll do some vigorous massage. And you may see a little bit of swelling. You'll see a little bit, you may even see a little tiny bulge here and there, and all of those areas flatten down. It's very uncommon that I have to come back and inject with 5-fluorouracil or anything like that to soften a collagen buildup. Bettina, how are you doing, dear?
Fine, I'm good.
Everything's looking good. Perfect. Okay, now I'm going to do a little bit more massage there, and we're just defining the jawline. If we're lucky, aging keeps coming for us, and so now we're just trying to stave off the future aging changes. Thank you for the hearts, and please do follow. We will be rebroadcasting later. You can't hurt the filler with the massage the way that I do it. I like to recommend that 5-minute massage 5 times a day for 5 days, but you can pinch, pull, up, down, side to side, back and forth to do the massage. Now, Bettina, I'm going to have you look straight ahead, thank you. And then now I just want to take an overall view. We did some through these areas, a little bit here, a little bit in the lateral brow, as she was asking for. The inferior orbital rim in this area laterally. Brow, temple, and I'm going to do just a touch more in the back of the jawline here. Let me turn your head this way a little bit. Very good. And we are finishing things up here. So this is the area that I want to build just a tiny bit more for balance. It's very nuanced, it's very subtle, it's a lot of artistry here. The most important decision you make is who is your doctor, and there is no doubt about it that fillers are the future of plastic surgery. No downtime, natural results, immediate results, and now we have the long-term fillers, you know, non-absorbable permanent fillers. Patients have more choices now than they've ever had before. How are you doing, Bettina?
Fine.
Bettina's tough. We try and make it easier than getting a tattoo.
I don't want a tattoo.
No tattoos today. We're very proud of our patients. Bettina's 81 years young and nobody guesses her age. If you tell people your age, they don't believe you.
No.
And she's got many active years ahead of her, so it's an honor to work with patients like Bettina. This is what makes our practice fun. I feel like I'm already retired, you know. I just get to come and spend time with Bettina and our awesome staff. I'm so proud of our staff. Charlene, Nina, Elisa's out today. Violet, Mindy, Stephanie, Thomas, and Ginger, Jennifer, Euphemia. We really have such a great group here, and they take such great care of me, and they take wonderful care of our patients as well. So, okay, now we've done the filler. So, Bettina, I want you to take a look, dear. So what we did is we softened some of the creases through here. Little touch in this area, little touch in the brow. She's a tiny bit swollen, but you'll pass the grocery store test today. If you walk into the grocery, no one does a double take.
No.
And Bettina really liked it that we were able to give her back some of the cheeks. So let me show you what we were able to do from her original pictures. I'll show you one more time because we showed this at the beginning. But we're very proud of Bettina. You can see here how, here we go. These are her before pictures, and obviously when she's much younger, you see the full of volume before we did lift and fillers, and hello Wanpen, and then you see from every angle she really looks very good. Okay, thank you. Yes, she does have amazing results. We're very proud of Bettina, and look how full she looks, but she still looks natural. She's not overdone. Okay, but literally every angle she looks so good. The neck and jawline tightened up. She does not look 80 years young.
81.
Yeah, 81 years young. So yeah, they said like Benjamin Button, right? She's really changed quite a bit. So thank you all for tuning in. We'll have more videos soon, so make sure you're following. But thank you. We're done for today, and congratulations, Bettina, and great job. All right, we'll see y'all later. Bye-bye.